Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Apollo Hospital, Bengaluru. So today I would like to talk to you all about an important advancement in breast cancer treatment, what we call as oncoplastic breast surgery. So breast cancer, as we all know, is a fairly common cancer. Lot of advancements have happened in breast cancer, and today we are looking at cure in majority of the patients. So we are going one step further and we are looking not just at cure in breast cancer patients, but can we improve their quality of life? So in this regard, the concept of oncoplastic breast surgery has come about. So we are not just looking at survival, but we are looking at improving the cosmetic outcomes in breast cancer patients. So what happens in oncoplastic breast surgery is that in the traditional surgery, we would remove the lump quite widely. So this sometimes would lead to a very distorted breast. Some patients are not very happy with the cosmetic outcome in these cases. So in oncoplastic breast surgery, the principles of oncology are combined with the principles of plastic surgery. So the patient not only undergoes oncologically safe excision, the plastic surgery principles are used to enhance the cosmetic outcome. So what are the advantages of oncoplastic surgery? First, the cosmetic outcome is improved. The shape of the breast is maintained and in some cases enhanced. Second, in certain cases, say the lump is a little bigger, we can safely go for wider margins because that defect can be filled with the principles of oncoplastic breast surgery. And thirdly, we can cater to individual patient needs. Like some patients may not be very happy with the cosmetic appearance of their breasts. So this can be improved at the time of surgery. So these are the major advantages of oncoplastic breast surgery. So how is it done? Now there are various techniques to oncoplastic breast surgery. Usually it involves placing appropriate incisions which are not very evident. And once the excision is done with a wide margin, the local fat tissue is sometimes used along with its blood supply to fill the defect so that the cosmetic appearance is maintained. In certain cases, if the requirement of the tissue is higher, we use what is known as flaps, either skin flaps, muscle flaps. These flaps are used to fill the defect. And sometimes symmetry procedures are done so that if there is a difference in the contour of the breast to the other side, there can be a reduction or enhancement of this. Along with this, the other important development in breast cancer surgery has been the use of sentinel node biopsy. Let me just explain to you what it is. Traditional surgery involves, along with the removal of the breast tumor, involves removal of the lymph nodes from the armpit. This can sometimes be debilitating, in which the patient's arm can get swollen, patient can have chronic shoulder pain, restriction of movements. Now in majority of the cases, it is not required to remove all the lymph nodes. We can inject a dye into the tumor or around the nipple areolar complex to see which lymph nodes are the first to pick up the dye, and these lymph nodes can be sent for analysis. This is done by various ways, by using methylene blue, by using radioactive material, or some in the latest we use a fluorescent dye known as ICG. So this totally eliminates the problems of axillary dissection such as arm swelling, shoulder pain and such things, and it helps patient maintain their quality of life. So we have to see if patients are suited for these two procedures, oncoplastic breast surgery and sentinel lymph node biopsy. Thank you.